Brittany.
I'm Haley.
I'm Maddie.
We're doing the muscular system.
There are many types of muscle diseases. The first one to talk about is multiple sclerosis, otherwise known as MS. MS is caused by damage to the myelin sheath, which is a protective covering that surrounds nerve cells. When damaged, nerve signals slow down or stop, and the nerve damage is caused by inflammation, which happens when the body's own immune cells attack the nervous system. It is unknown what causes the attack, but it is believed to be a virus or gene defect. Some symptoms of the muscles include muscle spasms, numbness, problems moving, coordination problems, weakness in arms, legs, or other limbs. Spinal taps and MRI of the brain and spine can be done to test for multiple sclerosis. There is no known cure, just medicines to weaken the symptoms. The next disease we're going to talk about is muscular dystrophy. Muscular dystrophy is an inherited disease that involves muscle weakness and loss of muscle tissues. There are different types of muscular dystrophy, and each type has different symptoms. Some of the main symptoms include muscle weakness that slowly gets worse, delayed development, difficulty using one or more muscles, drooling, problems walking. There is no known cure for muscular dystrophy, just medicines that'll help. The next disease I'm going to talk about is myasthenia gravis. Myasthenia gravis is an autoimmune disorder that occurs when antibodies are produced to block muscle cells from receiving messages from the nerve cell. Symptoms of myasthenia gravis include weakness of the skeletal muscles. There is no known cure, but treatment can help control symptoms like prescribed medication and a change in lifestyle. The next disease is soft tissue sarcoma. Soft tissue sarcoma is a cancerous tumor of the muscles, and it can occur in all places of the body, but the most common areas affected are the head, neck, arms, and legs. It is a rare tumor and the cause is unknown. Symptoms include a mass that can or cannot be painful. X-rays, CAT scans, spinal tap, MRI, and bone marrow biopsy are all tests that can be completed. Treatment includes surgery to remove the tumor, chemotherapy, and/or radiation. The last disease I'm going to talk about is spinal muscular atrophy. Spinal muscular atrophy is an inherited disease that causes muscle weakness and damage over time and eventually leads to death. It usually begins as an infant. Some symptoms include hard time breathing, hard time eating, poor muscle tone, and little movement. Some tests that can be done are brain and nervous system examination and a muscle biopsy. There is no known treatment, just supportive care and physical therapy.
Alrighty, and let's move on to exercising with muscular diseases. Now we're going to move on to multiple sclerosis and the different exercises that you can do to help strengthen the muscles and help reduce symptoms of multiple sclerosis. And like basic exercises like running, physical activity, anything physical activity can help strengthen the muscles. As we all know, multiple sclerosis is a muscle mass reducing muscle disease. New studies have found that the elliptical trainer, believe it or not, helps increase a lot of your muscle mass versus running and walking and all that stuff, although walking is highly encouraged. But if you're going to a gym to do some exercising, or if it's all required by the doctor, then the elliptical exercise is probably one of the best choices for multiple sclerosis patients, and you should also incorporate that into any single workout that you have. Spinning is another good one if you're looking into exercise equipment. Weightlifting is also a good one, although I wouldn't go too heavy with the first person, and always consult a higher person, i.e. a personal trainer or another person doctor-wise that will help you out with that. Now we're going to talk about muscular dystrophy. Alright, let's talk about muscular dystrophy real quick. A lot of exercises can be used with this one. The picture here shows the muscle arm on the left contains muscle that's been active. The right side of the picture shows muscle that's been inactive. That also shows the one with muscular dystrophy. In order to keep your muscles built up, a couple exercises, again, kickboxing involving your arms, a lot of boxing there would help out. Also, there's a couple myths out there. One of them is saying that a lot of exercise really, does a lot of harm to patients with muscular dystrophy, muscle diseases, and all stuff. But findings have actually found the opposite with it. That it actually truly helps you in the long run, helps improve your strength with it. Although there really is not a whole lot of cures with muscular dystrophy or any other muscle diseases, really. Exercise does help reduce pain and all that good stuff. Also, I know running and walking doesn't really do it, but moving your arms while doing it also helps. Like I said, boxing, anything to weightlifting, anything to do with moving your arms would really help you out. So, next, we're going to talk about myasthenia gravis. Alright, let's talk about myasthenia gravis for a little bit. It's quite an interesting disease. A couple exercises, actually a lot of exercises that can help with this are kickboxing, which is shown here. Kickboxing definitely moves all extremities of the body, which will definitely help reduce pain in the long run. Also will help with fatigue that the muscle diseases will put on you. Also, a newfound exercise equipment is the spinning machine, which is shown here. The spinning machine definitely helps out with fatigue also. Since there is no particular cure for this disease, any exercise that you can potentially get with the help of medications to help reduce some of the pain will definitely help out in the long run. So this is definitely a new piece of equipment that has been more revolutionized since the older versions to help out. Next is just plain out running, any marathons, run around the block, tracks, all that good stuff. That will help, as that also, increases muscle mass in the long run, helps keep you fit, and also doesn't particularly stop you from achieving any goals associated with this, or with beating this disease. So anyway, running is definitely a good one, as well as walking. So both of those combined can really help you out in the future. Next, we're going to be talking about spinal muscular atrophy. Alright, last but not least, we got spinal muscular atrophy. Basically the same exercises, running, weightlifting, anything kickboxing, spinning, anything treadmill work, that'll help you out in the long run. There is no cure for this disease though, which kind of sucks, but weightlifting and any exercise in general will definitely help you out in reducing any side effects and pain that you might have.
Now we will talk about muscle issues with diseases. At first we will talk about multiple sclerosis. With multiple sclerosis, or also known as MS, your muscles will either feel fatigue or will have a numbness feeling. With MS, you are actually not disabled. Some people will use a cane or even be able to walk but with an aid by their side. With being able to walk, with MS, you will still either feel a numbness or fatigue feeling. And with that, you will have a balance issue, and people will then sometimes assist in using a wheelchair, scooter, or crutches. The next disease we will talk about is muscular dystrophy. With muscular dystrophy, your muscles will either decrease fastly with Duchenne dystrophy or decrease slowly with myotonic dystrophy. We will now go into myasthenia gravis. Myasthenia gravis is when there is a droopiness to the muscle, which causes the muscle to decrease in a visual droopiness or sagginess to a facial or muscular appearance. We will now go into spinal muscular atrophy. This is when the brain cannot send signals to the muscle, causing them to decrease in size. This happens to children and adults, mostly going as a child and then going into an adult. The child will soon lose muscular strength and then have to become in a wheelchair and be assisted